like if you could watch your favorite network shows and view live streams when you are away from home? Download the official The V Network mobile app from the Apple App Store and Google Play Store. Search the V Network TV for iPhones and the V Network for Android phones. Receive notifications on upcoming shows, events, and network giveaways. Download it today. Don't be the last to find out what's going on your favorite network, the V Network.
Hey V Network viewers, I'm Mona Ricks, and I'm so excited about presenting the V Network exclusive spotlight. Here at the network, we like to focus on Black and Brown excellence, entertainment, education, and community involvement. And today I am so delighted to announce our V Network spotlight, North Texas Area Community Healthcare Centers.
Hi, my name is Patricia Rodriguez. I am the Chief Medical Officer for North Texas Area Community Health Centers, also known as NTAC. We are a community health center that has 3 locations in Tarrant County. Our largest is located on the north side of Fort Worth that opened up in 2018, 2-story building, huge, beautiful facility. We have another building that's in southeast Fort Worth off of 287 and Mitchell Boulevard, and then one that is located in Arlington. We have been here for the community for the past over 10 years and are here to serve everyone and anyone regardless of ability to pay. That is what we are here for. We are here to serve our community. We provide primary care for adult patients, for pediatric patients, for women's health patients. We also provide mental behavioral health services, diabetes education as well around hypertension and stroke. And we also have laboratory services on site. We also have a 340B pharmacy that can offer discounts for patients that may otherwise go without medication. The beauty about our health center is that we are partially federally funded. It is not enough to sustain our entire operation, but it is enough to be able to offset some of the costs that we incur for serving those who don't have the ability to pay. Therefore, we see everybody, those with insurance, Medicare, Medicaid, CHIP, or patients that are on state-funded programs. And then we serve people who otherwise can't pay, people who would go without services if we were not here. So that is really who we are at the heart of everything that we do. One of the other things that makes us really unique and special is that we have many services under our roof. In August of 2021, we launched the Eye Care Center here at our Northside facility. We have a wonderful optometrist who is highly trained to do diabetic and hypertensive eye exams. She can also do refraction and fit people for glasses. We partner with Lighthouse for the Blind, which is a nonprofit that helps us provide patients with eyeglasses at a lower cost that otherwise would go without corrective lenses. But what we've been able to do with the addition of our Eye Care Center is to really provide comprehensive medical care to our patients, all under the same roof. So someone can come and receive primary care services. That includes their wellness visits. We make orders for mammograms, for colorectal cancer screenings. We can do pap smears for women. We can handle obstetric visits as well and prenatal care. We handle all routine pediatric wellness visits, vaccines, labs, and also, of course, sick visits. And with the addition of the Eye Center, it really allowed us to really embody that comprehensive services that patients need. Our behavioral health department is also really critical in what we do because there are many times that patients can get a lot of the services that we provide. However, they may have barriers to care or difficulty being able to carry out the plan that was prepared between them and their provider, or they may be in need of behavioral health services themselves, and we're able to provide that here, which is really fantastic. Something else that is unique about our health center is that we do have academic partnerships. So for many years, we have had the fellowship for the family practice residency program from JPS come and do their 4th year fellowship here at our Northside facility to help gain additional skills in obstetrical care. Many of these fellowship residents end up going into rural parts of the state or other parts of the country. Sometimes they also practice outside of the country. And it is really invaluable for them to gain this experience. And they do this on a yearly basis. They rotate out those fellows that come through here. A second partnership that we launched was in July of 2022 with Baylor All Saints. They have now a provisional OBGYN residency program, and our OBGYN at the Southeast location serves as their attending physician. So these residents are able to come to our facility, help to see patients, help to learn, all the while they're continuing their education as well at the hospital and doing things in the hospital setting, such as surgeries and deliveries. So those are two things that make us really unique. When you come to NTAC, we take care of you like we would take care of our family. Your health, your wellness is our priority.
I'm Dr. Mary Kate Sain. I'm the clinic director at the Northside Eye Care Center, and I'm also a professor of practice for the University of Houston College of Optometry. The University of Houston College of Optometry has partnered with NTAC, or North Texas Area Community Health Centers, to be able to provide on-site eye care for our patients. In the Eye Care Center, we serve patients of the Community Health Center as well as everyone in the surrounding communities who may have eye care needs. The Eye Care Center offers a whole range of services, including routine wellness care. We offer glasses prescriptions, and we've partnered with the Lighthouse for the Blind in Fort Worth to be able to provide on-site optical services at an affordable rate for our patients. We also serve the medical population and provide eye care services for patients that have diabetes, that may have red eyes, glaucoma, cataracts, dry eye, and a whole range of medical conditions. One of my favorite parts of working in the Eye Care Center is getting to work with student doctors from the University of Houston College of Optometry. They get to come here every semester and work with our patients to give them the most thorough eye exams, as well as work with state-of-the-art equipment to be able to enhance their educational experience and be incredible doctors as they graduate from school. One of my favorite parts of my job is being able to integrate the different facets of healthcare within one experience. We've recently had a patient who came into the eye clinic because she had had progressive blurring vision for over the last year. She had a couple episodes of red eyes, and upon our eye exam, we found that she had had inflammation of the eyes. A lot of times this type of inflammation, or also called uveitis, can be caused by systemic conditions in the body. We did a thorough routine of blood work that she was able to have in our facilities. We prescribed her some medication that she picked up in the pharmacy downstairs on the way home, and we also set her up an exam with our primary care doctor downstairs. After we got her tests back and we were treating the eye inflammation, we found out that what was causing that was a systemic condition called sarcoidosis. That condition is composed of tiny inflammatory cells throughout the body, and with team effort with the primary care doctors downstairs, the eye center, and the pharmacy, we were able to get the patient the medication they needed and the care they needed so that they could feel better and see better to live their best life. Your health, your wellness, your vision is our priority.
My name is John Reed. I'm the Community Engagement Outreach Specialist for NTAC, which is North Texas Area Community Health Center here in Fort Worth, Texas, and Arlington, and also on the north side. The population that we serve is African American, Caucasian, Hispanic. It doesn't matter your gender, it doesn't matter your race. We there to help serve the people that's in the community. We are a state-of-the-art center. So don't feel like you're gonna get left out. Don't feel like you're gonna be shorted in no kind of way. We have state-of-the-art equipment in each and every one of our locations. So come by, stop by, just to see how we would treat you. Your health, your wellness is our priority.
My name is Lori Kennedy, and I'm the board chair for the North Texas Area Community Health Center. As board chair, I chair the meetings, help recruit board members from throughout the community, and serve on several committees, such as the Compliance Committee and Human Resources, committees like that. The board is comprised of people from throughout the community, from all different backgrounds. 51% of our board members are required to be patients at the clinic, and I am a patient at the clinic. That gives us, from being patients, it gives us insight to how the clinic operates, what we do well, what we don't do well. And so that helps us to make sure that we have community input, patient input at the board level. NTAC provides neighborhood clinics, and those clinics serve everyone. They serve insured, uninsured people. No one's turned away due to inability to pay. Anyone can come here. Anyone in our community can come to this clinic and be served. There's no screening process that they have to go through. And I think that's wonderful, because that's what I feel all communities need, is a place to go that everybody can go and be served and get quality health care, regardless of their socioeconomic background. Your health, your wellness are our priority.
I'm Ralisha Bowles, and I found out about the Northside Community Health Center from John Reed, who is over the community outreach, and he had an opening event at the East Side location. I went there to book an appointment, and I ended up here at the Northside Health Community Center. Dr. Dora Bradford is awesome. I love her bedside manner. She's very respectful and very confidential. I feel secure with talking to her about any issues that I have. She's my OBGYN, but a lot of times I feel like she's my PCP because I can talk to her about exactly what I'm feeling. She gives me feedback, she provides information, and she also encourages me to, she encouraged me to go and find out more about the health concerns that we discuss so that I can know further, and she gives me tips on how to take care of myself as well. So I love my doctor and the experience that I receive here at the center every time that I come.
My name is Jerry Whitaker, and I'm the CEO of NTAC, and I've been here since August of 2017. I came here because this is the work that I've been doing all of my professional life, and have worked in health centers for the last 30 years. Actually grew up as a health center kid. I went to health centers when I was a young person. My family went to health centers as I was growing up, so I know the value. My current family, my daughter, my husband, my grandchildren, all come to NTAC. One of the reasons that we come is it is a complete service. They look at the whole person, we look at the whole person, and make sure that you get the appropriate referrals. If your child needs their eyes examined, we make sure that that referral is in place and you can sort of walk upstairs. So we are a full service family health center. NTAC came about in 2005, I think, but it's very young in the world of health centers. There are approximately 1,300 health centers across the country, and the original intent of the legislation which created community health centers was to give neighborhoods control of their own health, to give neighborhoods back some of their tax dollars to be able to manage their own health. So part of that legislation required that 51% of the board members must be active patients, so that when they sit down and talk about what the needs of the health center are and the needs of the community, they're speaking from experience. They live in the community, some of them work on the community, but they're actual patients. And so that's what keeps us motivated, because we hear from people who use the services about whether the services are good, whether we need to add services. Another requirement by the federal government is that we look at our service hours every year. So the board reviews the service hours to see whether they're meeting the needs of the population, that we look at our patient satisfaction, and that we are held accountable for outcomes. So an example of that is, if you come into the health center and you're a diabetic and you have an A1C of 12, it is our job to get those numbers down. And so we've created specialized programs for hypertension and for diabetes, for those chronic diseases, to really work with people to get them down and to manage them. And on both the hypertension and diabetes side, we saw some real progress. We call ourselves a community health center, but we're really a neighborhood health center. So we service all people. We service people from all walks of life, from all socioeconomic statuses. We are a neighborhood health center. We're here to provide high quality health services at a convenient site. Some of the folks that work here are your neighbors. And so we really kind of keep our ear to the ground in terms of, we hire staff from the neighborhoods, we give them training, we work, to help them move up professionally, but also to take care of their own neighborhood. So when you talk about the socioeconomics, like I said, we see people from 0 to 100 from all walks of life. However, one of the requirements is that people are seen regardless of their ability to pay. And so what that means is, does not mean free. It means that we're going to adjust your services based on your income. And even if that day you don't have any money, we're going to see you. Your health, your wellness, our priority.
What a fantastic way to end National Physicians Week. The North Texas Area Community Health Centers has shared with us that they have a wide variety of services right in your community, right in my community. And whether you have insurance or not, they will not let you leave without being served. Right in your community, North Texas Area Community Health Centers, your health, your wealth is their priority. And here at the V Network, I feel so delighted to have had the opportunity to spotlight them as the V Network Spotlight. And as I mentioned before, we focus on Black and Brown excellence, education, entertainment, community involvement, and events. So you can look forward to seeing more V Network Spotlights. We'll see you next time. I'm Mona Ricks. Bye.